Physiowebseries Knee Complex Season 1. Let's begin with Series 2. As prior to this, in Series 1, we discussed about knee flexor muscles, their origin and insertion. Those were hamstring group of muscles including semimembranosus, semitendinosus and biceps femoris long and short head. Other than that, sartorius, gracilis, gastrocnemius and popliteus. Those are knee flexor muscles. Now let's have a look on those muscles acting on tibia. Apart from flexion, what other action they do on tibia? Let's have a look on that in series 2. So starting with series 2, medial rotators of tibia are semimembranosus, semitendinosus, sartorius, that is triple S, and other than that gracilis and popliteus. So these 5 muscles are medial rotators of tibia. We can see semimembranosus and semitendinosus originating from ischial tuberosity and inserting to the proximal aspect, medial tibial condyle. We have seen that earlier. So these both have action of medial rotation on tibia. Next is sartorius. So as we can appreciate, coming from ASIS to the proximal aspect of tibia below the medial tibial condyle, as we discussed again this also. So sartorius is also a medial rotator of tibia. Another one is popliteus, which comes from lateral femoral condyle and the meniscus, lateral meniscus, posterior aspect to the posterior aspect of tibia, posterior and proximal aspect of tibia. So popliteus is also medial rotator of tibia, which has origin from here going towards the tibia. So acting as medial rotator of tibia. And the last one is gracilis, arising from istiopubic ramus and inserting to the medial aspect of tibia again, as we saw earlier. So 5 of these muscles, as can be appreciated in diagrams, semimembranosus, semitendinosus, sartorius, popliteus and gracilis are medial rotators of tibia. Lateral rotator, the remaining one is biceps femoris. So both long as well as the short head of biceps femoris are lateral rotator of tibia. We know that long head coming from ischial tuberosity, inferomedial impression of ischial tuberosity, and short head originating from linea aspera, that is distal linea aspera, and lateral supracondylar ridge of femur inserting to head of fibula. Both of these inserting to head of fibula. They are lateral rotator of tibia. Also in position they are lateral ways. If we check in the back of the thigh, so they are placed more laterally and also are acting as lateral rotator of tibia. Other than this, there are muscles producing valgus or abduction movements at the knee, which are located at lateral side of the knee, lateral side of knee joint mainly. So we can appreciate this in those diagrams. So first is biceps femoris, both long and short head. They are at the lateral side of the thigh, we know that, or lateral side of the knee joint inserting here. So this will also create valgus movement at knee joint. Another one is the popliteus, traveling this way. This will also create valgus movements at knee joint or abduction movement at knee joint. The last is the gastrocnemius, but only the lateral head of gastrocnemius. Only the lateral head of gastrocnemius will produce valgus movement at knee joint. So 3 of them, biceps femoris, popliteus and lateral head of gastrocnemius, will produce valgus movements at knee. Same way, let's now see next one, varus or adduction movements at knee joint. By which muscles? Semimembranosus, semitendinosus, sartorius, gracilis and gastrocnemius, only the medial head in this. And as they are producing varus movements. They are located at medial side of the knee joint. We know that. We can appreciate over here semimembranosus, semitendinosus at the medial side of knee joint, producing varus movements at knee joint or adduction movement. Then sartorius, also producing varus or adduction movement. Then gracilis at the medial side of knee joint can be appreciated very well, also produces varus movements. And the last is the gastrocnemius, this time only the medial head of gastrocnemius muscle, producing varus movement at the knee joint. Now let's have a look at certain basic concepts. In those basic concepts, let's start with pes anserinus. We discussed about this term in series 1. Pes anserinus is also known as goose foot. It is formed by common tendon of three muscles, semitendinosus, sartorius and gracilis. Can be appreciated well in this diagram. So let's have a look. Semitendinosus, gracilis and sartorius. Three of these muscles inserting as a common tendon as pes anserinus to the proximal medial aspect of tibia. This was about pes anserinus. Now, a point to be noted about short head of biceps femoris as compared to long head of biceps femoris. The long head, which is originating from the ischial tuberosity, the inferomedial impression on ischial tuberosity. So it is crossing the hip joint. But if we talk about the short head of biceps femoris, it is originating or starting from lateral supracondylar ridge of femur or the distal linea aspera. So it is not crossing the hip joint. So it will act only on knee joint as a single joint muscle. So short head of biceps femoris is a single joint muscle crossing knee joint, or it is not crossing the hip joint, so will act only on knee joint. So this was a quick note to remember about short head of biceps femoris. Another thing to remember is that in non-weight bearing activities, the hamstring will generate posterior shear force of tibia on femur. So in non-weight bearing activities, when the feet is not on the floor, at that time, hamstring during knee flexion activity, hamstring, we can see that this is hamstring and here we have tibia. So hamstring will generate posterior shear of tibia on femur. So this is hamstring inserting somewhere here proximal tibia and will create posterior shear on tibia. During this, there will be increased strain on PCL, that is posterior cruciate ligament, and decreased strain on ACL, anterior cruciate ligament. So this was also a key point to remember, that hamstring creates posterior shearing force of tibia on femur, hence causing increased strain on PCL, posterior cruciate ligament.